Physician-assisted suicide should not be legal because I believe it will increase the number of people ending their own lives, resulting in many unnecessary deaths. According to Dr. Joke Groevers, a Dutch physician and former supporter of physician-assisted suicide, if a doctor gives people the option to die, they will choose it. But if doctors focus on the option of good palliative care, then patients will choose that instead. The Netherlands provides a good example of how legalizing physician-assisted suicide will increase the number of people choosing death over treatment. Physician-assisted suicide was legalized in 2001, and statistics show that from 2001 to 2011, the number of deaths resulting from physician-assisted suicide rose 50%, from 1,923 deaths to 4,000. If people were given the option to continue life with good palliative care, then the need for physician-assisted suicide would be minimal and unnecessary. Furthermore, if physician-assisted suicide becomes a medical option, it's possible that people will choose it not because it's the best option, but out of a sense of obligation or guilt. Elderly patients who depend on their families for care may feel they are creating an unnecessary financial or emotional burden on their family, and that choosing to end their lives would lessen the burden. In fact, some go as far as to argue that certain patients, particularly those who are placing a physical, emotional, or financial burden on their loved ones, have a duty to die, rather than a right to live. If we legalize euthanasia, we could be creating a situation where individuals are expected to choose euthanasia out of love or a sense of duty for their families. It's even possible that vulnerable people may be encouraged or guilted by their families or doctors to choose physician-assisted suicide. In these cases, physician-assisted suicide is no longer about the patients themselves, but about their families, which means that the decision might not be the best choice for the patient. Most significantly, many patients who suffer from terminal illness are no longer able to make decisions about their own medical treatment. Their medical decisions are entrusted to their family members or doctors who might not have their best interests in mind. If we make physician-assisted suicide legal, we may see more cases of non-voluntary or involuntary medical suicides. In a study of physician-assisted suicide deaths in Belgium, doctors reported that 32% of the deaths were without a direct request from the patient. If we give doctors the power to end patients' lives, it will become difficult to separate cases of patients who want to die because they think it is the best choice for themselves from cases where a patient's death will benefit their family or others.